was that the Moderna shot used mRNA technology, which you might remember is the same technology used in COVID shots. So here to discuss what this means for, our flu vaccines, senior scholar, Johns Hopkins Health Security Center, Dr. Amesh Adalja. Welcome back, Dr. Adalja, on this. I mean, I was reading some of the reaction from Moderna officials now. They were shocked by this. Should they be? What did you make of it?
They should be shocked. They should be upset because what happened is the FDA has changed the rules in the middle of the game. Moderna and the FDA had met about this mRNA flu vaccine. They'd understood what the clinical trial was going to have. And now at the finish line, the FDA has kind of moved the goalposts without telling them. And now all of this research, all of this time, all of this money is now sunk. And you have to assume this is just because of this animosity that the administration has towards mRNA vaccines. That's what really engulfed this Moderna product.
Because, the conversation about vaccines even this week has been interesting within the administration. We know, and, we always talk about Bobby Kennedy, the health secretary, but Dr. Oz, with what's been going on with measles, had some interesting comments. And I wonder if there's some internal strife or something going on. But here's what Dr. Oz said.
Take the vaccine, please. We have a solution for a problem. Not all illnesses are equally dangerous, and not all people are equally susceptible to those illnesses. But measles is one you should get your vaccine.
So, what'd you make of something like that? I said earlier in the show, it's not really much of a headline coming from a doctor, right? But within this administration, you sort of wonder how they approach the issue, as you just said.
I certainly hope it signifies that there's strife going on in HHS because clearly Dr. Oz is right and RFK Jr. is wrong on this like he's wrong on most things. And this isn't controversial for a physician like Dr. Oz to say, but it is true. We have a solution to these measles problems. All of the measles problems we're having in the United States are self-inflicted because people are choosing not to use the solution, which is the vaccine. And I'm glad to see Dr. Oz coming out in favor of the vaccine. It just needs to be the case that RFK has to be removed from HHS in order that we get science back into our health policy.
Let me look at a map just on the measles stuff. We have a map and then I have some numbers. The measles cases confirmed in nearly half the country. So, we're seeing a lot more of this. And, people blame the lack of vaccination, as you've talked about. But if you look at the actual data, 2026 confirmed cases 733. 2025, that number was up. I mean, 2,276 as confirmed cases last year. So again, this is not something that we should necessarily be talking about. Maybe that's why Dr. Oz chose to speak out about it, or?
Exactly. This is something that we shouldn't be seeing. We're only 2 months into 2026. We're not even 2 months into 2026.
Right.
And we're already having a banner year. 2025 was a banner year. We're likely to lose the elimination status that we've had for 25 years in the United States in terms of measles. We've had deaths from measles in 2025. We continue to have hospitalizations and severe complications. And this is all for nothing. This is all because of this anti-vaccine ideology that has creeped into the population that RFK Jr. has promoted. And it has real consequences now, and you're seeing it on those maps. And now we may face the fact that we may have to face the idea that measles becomes an endemic disease again. And all the work to eliminate it is basically for naught.
Final thing on this, it's more of a big picture question, but I'll use some more data. This is the childhood vaccine schedules, which has obviously been something that we've talked a lot about as well, and the changes that are made and which vaccines you were previously being recommended, whereas at the bottom of the screen here, they have now no longer being recommended, hepatitis A and B, and it goes down the list there. So what would you say to people that, about the actual impact of Robert F. Kennedy Jr.'s health secretary? What's the tangible impact going to be?
The tangible impact is going to be the anti-vaccine movement becomes basically their talking points are now the talking points of the federal government, including storied public health agencies like the CDC, like the FDA, like the NIH. They have been completely captured by RFK Jr., and they are now the wings of anti-vaccine propaganda machines. So what the tangible change is going to be is we see what's happening with measles. We see that replicated with other infectious diseases, and we turn backwards in time when it comes to control of infectious disease, to a time when these infectious diseases were much more disruptive events in our lives. And they don't need to be because of the science and technology of vaccines. And that's what the tangible impact is that he is pulling us towards the dark ages. His is the voice of the primitive, and he does not even believe in the germ theory of disease. This is the person who is now running the Health and Human Services Department for the federal government, someone who doesn't believe in the germ theory of disease.
Let's leave it there for now, Dr. Adalja. We'll have you back. We always appreciate you on these issues. I'm Connell McShane, live at